Good evening, everyone, and welcome to the Academy of Leadership and Innovation's Global Health Special Interest Group Town Hall. We're so excited to have you here with us. We expect, based on our invitations, that there will be a few more people joining us over the next few minutes. So we'll continue to welcome people in. But I'd like us, in the interest of time, to go ahead and get started. I'm going to introduce myself. My name is Kai Kennedy. I'm a physical therapist. Currently in California for another week and a half, and then we'll be in Virginia, which is my home state. I am the chair of the Global Health Special Interest Group, and I sit on the board of the Academy. And I would love for our board members in attendance this evening to introduce themselves. But first, I want to invite you all to introduce yourselves too, if you could do so in the chat, and let us know any global health projects that you're working on. And while you start to enter that information, I'm going to ask our board members if they are so able to join us briefly for a quick introduction and anything you want this group to know. Kathy Clark, can I start with you?
Sure. I'm Kathy Clark, and I'm a pediatric physical therapist, and I help with the communications committee for the Global Health SIG, along with Bonnie Virag.
Thanks, Kathy. Cheryl, how about you next?
Yeah, hello everyone. I am zooming in from Seattle, Washington, and I've been helping out with the research and publication work that we're doing with the SIG.
Longtime champion of our SIG there. Thank you.
Thank you.
Aaliyah, are you able to speak for a moment? I think Aaliyah might be in the car. So Tara, can you, oh, I see you're chatting in the chat box. Can you unmute? Maybe not. All right. And Maria, please introduce yourself.
Hi, I'm Maria, and it's my first year to be the programming chair for the Global Health SIG, and I am based in New Jersey, practicing in an outpatient clinic.
Thank you so much. We're so excited to have all of you here. We see some folks dropping their names and their work in the chat. As soon as I hand off my speaking duties, I'm going to do the same. If you're just joining us, we invite you to introduce yourself in the chat box and tell us any global health projects that you might be working on. I want to check in with Kathy and see if you had any other questions you wanted to ask this group.
I would love it if people are so inclined to drop a note in the chat box about why they joined the Global Health SIG. Nice.
Awesome. Thank you so much. And I'd also like to give our board members an opportunity to give any announcements to this group. I want to take the opportunity to thank our publication team and our entire team as we've started to launch our new Global Health SIG publication, The Compass, you might have received in your inbox. So we want to invite you all to take a look at that publication as it comes out each month, and perhaps even give us a reason to highlight you in that work. We'd love to be highlighting members and their work. That's part of the reason we want to get an idea of what everybody's working on in the chat, to foster collaborations and interactions between you, but also to give us a good idea of what we all do together in this space. I also want to give kudos to Maria, who you're going to hear much more from, for starting our podcast series. And you're going to hear from one of our first speakers, a couple of our first speakers on the podcast in tonight's town hall. So we'd love for you all to tune into that podcast, offer your ideas for topics, offer your engagement with the speakers, and get involved that way. You may know that the Global Health SIG for a long time at the Global Health Reception has invited members to share their global health work by way of poster. And we're wanting to extend that conversation beyond the CSM event days. So we'll continue it with the podcasts, and then we'll continue it in forums like this. Thanks so much for the people who continue to introduce themselves in the chat, and welcome to those of you who are just joining our town hall here. We're taking some time to introduce ourselves in the chat box, who we are, where we're from, and what global health projects we're working on. And let's see. Oh, and we've also asked why you joined the Global Health SIG. So feel free to drop some of that in the chat. And I think without further ado, I'm going to hand it back over to Maria and ask you to tell us a little bit about posters and the podcast, and introduce our speakers for us.
Okay, thank you, Kai, and welcome everyone. So tonight we're actually kicking off our posters in a podcast via town hall meeting. As you know, as much as a lot of our Global Health SIG members who want to attend the CSM, not everyone is able to do so. And even when you're at the CSM, there's so much happening that you may not be able to get into the poster presentations. Meanwhile, we have a lot of members who are very much actively engaged, both in the local and global community, doing a lot of work that I'm sure a lot of us actually have passions about. And with today's technology available to everyone, we thought that this would actually be a good way to bring those programs, presenters, actually share all this information going around to our members. And so for tonight, we've actually invited two of our poster presenters. One of our poster presenters is Sterling Koehn, and she is right now a third-year DPT student at the University of Arkansas. And the other is Dr. Laurie Farroni, who's an associate professor at the University of Texas in Galveston. So both have a lot to share with us today, and I'm actually going to turn the floor to them. I'm going to give them a few minutes to give highlights of the posters and their presentations, and I will then open the floor to all of you, to ask questions. So Sterling, let's start with you.
Good evening, everyone. I'm really excited to be here, and I thank you for this opportunity to talk to you guys. Like she said, my name is Sterling Koehn, and I am a third-year student at Langston University in Oklahoma. I participated in a service learning project called Learning Equity and Inclusion for All in Provision of PT Services in Rural Communities. During the service learning project, I learned to provide inclusive physical therapy services to the uninsured or underinsured using a sliding fee scale in rural communities while ensuring equity in design. The goal of this project was to learn how to serve all members of the community regardless of their ability to pay. We first conducted a community needs assessment and then devised a physical therapy business plan for a clinic that would fulfill the physical therapy needs for all in the community. For this purpose, we met with community managers and also a physical therapy clinic owner to gain insight into the rural practice of physical therapy and the reality of pro bono work. We discussed the advantages and disadvantages of independent practice opportunities, collaborative practice opportunities, consultative physical therapy services, fee-for-services, as well as pro bono services. As a result of the service learning project, our team was able to design a business plan for a mobile physical therapy clinic that demonstrated a positive income while also providing 25% pro bono services. The methodology of our service learning project included our class being divided into two teams. Each team had to design their own business plan. The one that we're talking about specifically that I was on is a direct access physical therapy practice business plan for a diverse community in Pawhuska, Oklahoma, which has a high population of low-income individuals. We first began by doing a community needs assessment via a survey to 3 different groups of stakeholders to get a cross-section of responses. After the needs assessment, we realized that there was minimal interest in Pawhuska for a sports physical therapy clinic, but more of a high interest in learning about prevention and wellness and fitness. Therefore, we were able to modify our initial plan accordingly to be able to better serve the needs of the community appropriately. Our next steps were to create an organization structure chart and operational policies and procedures, employee job descriptions, innovative facility floor plan designs, patient employee quality assessment measures, and a low budget marketing advertising campaign and logos. And finally, the financing, planning and budgeting. During the designing phase, we sought guidance from an accounting healthcare professional, as well as a physical therapist practice owner. And then after we finalized the business plan, we also had an opportunity to present our final product to CPAs who were able to provide their constructive feedback for our success. Overall, the service learning project taught us skills that we can apply after graduation to own and also manage our own physical therapy businesses while meeting the needs of the rural communities and the underserved. Thank you, and I welcome any questions at this time.
So thank you, Sterling. So we'll reserve the questions in a little bit, and I will move forward with Dr. Farroni, Laurie, to give us an introduction of the project that you were in.
All right, thank you. Happy to be here. I've been a member of the SIG for a number of years and see some familiar faces. And I'm excited to share about a local global health project that has really evolved pretty organically, with the idea coming from a student originally. Galveston Island, we like to say Texas adjacent, not attached, and but we are sort of the end of the road for a lot of people. And we're a very eclectic population. We do have a high number of underinsured and uninsured people that live on the island and in the county. And our island actually has a pretty robust freestanding pro bono clinic that we are in partnership, our academic institution and that nonprofit. However, the island is also where much of our greater county's population of persons experiencing homelessness aggregate because of we have one of the only transitional housing facilities. So for a variety of reasons, we have a large population here. But the irony being that many of the resources that population requires, those resources are off the island. And you cannot get off the island without funds, and it is illegal to cross our causeway by foot. So it's a very complicated place for that to be a lived experience. And we, over the years, have had many students commenting on how we don't see that population coming into our regular pro bono clinic. And it just so happened that I had a very vocal student who had a real heart of an advocate. And I started asking some of our partners what was going on in their spaces. And we had some newer partnerships evolving under other initiatives to serve this population in our community. And we just started having conversations with a few orgs and to see if we could develop a mobile clinic as an offshoot of our pro bono initiative that was much more in a natural environment for this population. And so it started out with students thinking that we would be in this space and be fixing adaptive equipment or giving out adaptive equipment and wheelchairs and maybe making simple recommendations. We called it mobility clinic from the outset. And that's really how we started. And we started integrating ourselves with an evolving interprofessional clinic there. And now inside this space, it's actually inside a church space that offers biweekly services to the community: showers, meals, bus tokens, social work, psychiatry, and housing, other housing services, transitional housing services. And we offer a clinic that is just integrated in the community space. And so philosophically, we really have, we try to make it a space where people feel welcome. We remind our students that they are guests in the space, that it is a community-run, community-led clinic. The board has members of the community, of persons experiencing homelessness, other Galveston community members. We have a bioethicist on our board, and we've try to be pretty holistic in design. We're just now getting to where we're starting to look qualitatively at the work we're doing. We do full evaluations and treatments, because what we found is that many of our patients that come in, they cannot access even the regular pro bono services because of the rigidity with appointments and transportation, etc. So we have a walk-in PT clinic, and we do everything from foot baths to shoe adaptations to assistive device modification. And our students work in a comprehensive interprofessional team if that's needed. And so they learn how to have really critical conversations and how to prioritize what the acute need of the person is, presenting in front of you. And it's hard, because they want to, roll through every special test under the sun, and all of that. But in the moment, in these encounters, I think that what they're learning is to really listen to the person in front of them, to take in their story, to let their needs drive the bus. And it's just been a really incredible synergy of people in the Galveston community, students, the academic institution, and we've really developed a really nice, sustainable model where we have leadership change throughout our student cohorts. And I'm over time, but one other little thing is the other thing that have been really intentional about integrating in these experiences for our students is the work of advocacy, being involved in local governance. And we have now on our island about to open a new, more progressive transitional housing model where we'll have beds for people to stay in for over a year and access wellness services, etc. So the students have seen what learning and working inside this community and learning how to be an advocate, be involved with its city meetings and city planning, to try to get them to see a little more of the waterfront of what it's like to really live inside this community space.
Thank you, Laurie. I think your students are learning a lot more, outside as much as inside of the four walls of the school, definitely. So my first question is actually going to be a follow-up on Sterling's poster presentation, and I'm going to open up the floor for everyone to ask. You can either raise your hands, if you want to ask your questions personally, or if you want to type them in the chat box, it's also open. So Sterling, can you share with us the challenges and the opportunities that you've actually seen, going through like this whole exercise of community needs assessment, right? And actually making it viable for you to actually be able to, really run with it if you choose to, right, after your graduation. And that's actually going to be my second question, is that are you more likely to do this right after graduation? Is private practice in this model something that you've now entertained because of the experience?
Absolutely. I think initially, people before they graduate say, oh, I want to have my own business and all these things, and they're really ambitious about it, or sometimes they're even on the opposite side and they're really timid about even approaching that thought of it. And this project was really important for us to be able to see all the ins and outs. And even as employees, if we don't choose to own our own business, it really helps us to appreciate the businesses that we do work for, because there's so much that goes into owning your own private practice. And I think personally for me, I can't really 100% say it. I think initially I would like to just put my feet on the ground and be a physical therapist for a little while before I entertain the idea of going out on my own. But with that being said, there are lots and lots and lots of challenges that can go with owning your own business. And this just opened our eyes to some of those challenges. And for me personally, just as maybe part of my own individual self, the finances and learning all of the fiscal responsibilities that go into owning your own practice, that was a big challenge, learning the books. But as far as the needs assessment, we submitted approximately 200 surveys to the area of Pasca and that surrounding areas, and we only received less than 50 responses back. So we were still able to get a good picture of what needed to happen, but also is it the full picture that the community, I think that was the biggest part, was just getting everybody to be able to participate and tell us what we were able to provide for them.
Thank you, Sterling. I could tell you, as a small, business practice owner, one of our clinics has actually been existent for about 15 years now. It's also community-based. It's mom and pop. It's co-owned by my husband, who's also a fellow therapist. And then we also ventured into serving an underserved community in the Bronx part of New York. And after about 2 years, we've actually decided that, you know what, yep, as much as our heart is into it and wanting to serve the underserved community, it's actually really not fiscally, possible right now to actually really balance that with the quality of care. And for now, if I can provide quality of care, then I'd rather not be there. So kudos to you, and I hope that this is something that you'll still entertain though in the future. Okay, Kai.
Thank you. Yeah, I just wanted to ask a question, follow up for both of you, actually. Thank you so much for your presentations. I think they are such a nice complement to one another, different types of communities, different types of models. I'm curious how you both feel about whether experiences like this should be elective or whether they should be required, compulsory parts of training in our field. We realize everyone's not going to have a career, right, steeped in this advocacy work. And yet we give the building blocks of so many areas of practice. So I'm just curious if you think that your project is something that all PT and PTA trainees should have access to, or just those who are interested.
Yeah, I think personally, I know this was an elective class, but I think if I were to go out into the field and not have any type of background knowledge, I would be way more timid about owning my own business. And this opened my eyes to all the different avenues. And this is one of those, that's what I love about physical therapy. You have so many different avenues that you can navigate, and you can have your own business, you can work for somebody in the hospital, you can work for somebody, and there's just so many different outcomes that you can have. And I really, really appreciated the fact that Langston University allowed us to be able to entertain the idea of being successful in owning our own business. And I just really appreciate the thought of being successful. And yep.
Thanks, Sterling. Laurie, any thoughts?
Yeah, so I have a lot of thoughts on that question. And I've had many conversations with faculty and administrators about that question. So I see it, I can see it from a lot of different perspectives. In our program, and for our residential students, we have a hybrid program also, but our residential students, at some point, they will go and have some type of assignment or activity at one of our community partners. Many of them will not go to all of them, but a subset of students will go to all of them every week, And philosophically, I love it when a student doesn't, maybe think that they would like it and they're required to go, and then they go and then they suddenly have this, sort of aha moment of, I enjoy this work, I want to be with this population, and that's lovely. But at the same time, what I tell the students is our work in the community is community first, and your learning is secondary. And these educational opportunities are beautiful for you, but they can't come at the cost of the relationships we have with the people that we're serving. So I feel like specifically in this initiative in this community that's very averse to seeking care and has had many medical establishment struggles, I do not require students to go into this space. We have a lot of prep training. We talk about it. We try to demystify what we do there. And I have and really it's student to student that does that. But I don't, it's not a space that I feel like should be mandatory, because I think it compromises our relationships with the community. That said, we have a lot of variety in the community partnerships that we do have. And our regular pro bono clinic, it feels much more like a regular outpatient clinic. And there's just an ease in that space for some students, and that's fine. But they still get the idea of working with persons that don't have this, private insurance, etc. So, but I'll stop there and won't talk for 3 hours about that.
No, I love it. I think that's exactly the type of discussion that the town hall is intended for. So thank you both for providing those. It's a nuanced conversation, right? And I think that's the purpose of trying to be in community with each other. So I'm gonna hush now and turn it back over to Maria or anyone else who has a question or a comment on that topic.
Yeah, I'm actually trying to see if there's anyone who would like to ask,
It looks like
comment.
Eugene
Yes,
is,
Mr. Eugene.
yeah.
Yes. You need to unmute though. There you go.
Here we go. I wasn't planning on being here this evening, but I saw that the topic was kind of interesting from where my perspective is and where I've been in my physical therapy career. I've been a member of the APTA for 63 years. After graduating from New York University with a master's degree, I worked in New York City or in Staten Island for a few years and decided to look around to see whether there might be something else closer to where my home originally was, which is in Massachusetts. I noted that the University of Massachusetts Medical School was just starting up in the Worcester area, which is central Massachusetts. I looked at the area and found there were 13 physical therapists in all of central Massachusetts. And there was a lot of potential for providing services to people who needed services because there were no services. So I came on board, took a position with a rehab agency and found that there were a couple of hospitals that needed physical therapy services. So I decided, well, let me try this. Long story short, we now have 3,000 physical therapists in central Massachusetts. I started a practice as a solo practitioner and grew my practice to 5 clinics with 50 physical therapists throughout central Massachusetts. It worked, and it continues to work because there are very many private practitioners in central Massachusetts who go and look for where there's a possibility that there may be some need. And just as you were speaking about, Sterling, and also, and you here, there's potential there everywhere. And I think new physical therapists can really move ahead and find places where they would be impacting the population, where the need is there. And there are definitely needs, not just in this very highly populous area of central Massachusetts, but throughout the country. And my take is move ahead, do things. I thought I'd just stay private practice forever, but went on and decided to become more involved with my licensing board and with the Federation of Physical Therapy Associates of Physical Therapy Practices, and moved ahead in that, got a PhD, and just continued moving. And I'm quote semi-retired, but I'm still seeing patients. I saw a patient today because I'm working primarily with people with balance problems, and life continues. Even with 80 some odd year olds. So tell your students, keep moving ahead because there's potential out there all the time. We are a distinct profession that can do a lot of good. Appreciate being here with you this evening. Thank you.
Thank you for inspiring us with your 60-something years, of, service to the profession in every way. And we're happy that one of you have actually have been, I think, in 60 years, right? They're really one of the pillars of the profession. So thank you for that. Okay, anyone else who would like to ask any questions? If not, I'm actually going to direct my question for now to Laurie. Laurie, we've actually talked about the experiences of the students and how, the actual interaction with the population have actually shift on their biases. Can you tell us more on that, please?
Yeah, so we're just starting to look at through a few different mechanisms. What are our students' perceptions on people experiencing homelessness? What were their experiences with that population prior to coming into the clinical space? And for many of our students, they have some reactivity to that population, some nervousness, insecurity, and a lot of assumptions around behaviors, addiction, mental health, etc., and just in a general discomfort to some extent. And so what we're finding, and I'm just sharing this anecdotally because we haven't dug into this yet, that's what we're in the process of doing, but just a lot of reflecting on what it means to be able to just sit with someone and hear their story and have this very humanizing event that isn't as structured as it is in what feels like a more clinical setting. So students have very different reflections and perceptions of the patients they're working with inside that type of space than they do in our regular pro bono outpatient clinic. So I can make assumptions, but they would be assumptions at this point. But like I said, anecdotally, there's a lot of shifting in moving away from being afraid of seeing someone in the community that lives on the street to having an ease with having a conversation and having some awareness around what their lived experience is like.
And that's the thing about bias, right? The best way where they say we can't really change our bias, it's inherently there, but chipping away at it requires like a personal interaction with people. So that I'm sure that's a great experience for your students and for some of your faculty members as well. Anyone else who would like to ask questions for Sterling, Laurie, Cheryl?
Yeah, and I'd love to hear from both of you. What are some of the barriers and challenges to maintaining the sustainability of your programs? And we can, talk about what really helped to help with that sustainability. Maybe we should do the positive and then maybe the challenges. Sterling, you want to start?
Yes, I'm trying to think about how to answer, just so I understand the sustainability of doing a mobile clinic.
Or even, within your DPT program, being able to have that opportunity for students, what were the, the supports and
Okay,
what
so
was the challenge?
maintaining the project in the program.
Yep.
Okay. Well, I'm not really 100% sure how to answer, but I know that I'm thinking it might be best if Laurie goes first while I formulate my response.
Sure, that's happy to do that. This is always the question I have at the end of every semester and every shift with budget year, etc. But where we are now, I feel like is a pretty good spot sustainability wise. So we have a little bit of institutional funding that supports community engagement activities. That's probably the smallest amount. We do have we've applied for as a clinic center collaborative funds from various organizations in the county, and that there's a lot of contributions that come in that way. So those are the financial resources we have. The space we have is free because it's inside a community space. So really the cost of doing what we do, what we call mobility clinic, is pretty low. All of the devices are donated. The student leadership I have is amazing. They run assisted device donation drives. We do shoe fittings, shoe drives, and everybody has, plenty of that to give away. So the materials is not the fiscal part is not the challenge. The challenge is really the scheduling, the protecting the time on the calendar for the students and for some faculty, because it is mostly volunteer based. We do have some electives that feed hours through the space, but by and large, it is run by volunteer faculty and volunteer students. But I feel like we're so integrated and established now that it isn't hard for us to have the amount of support we need. But it's always a worry. And as you all, if any of you fellow teaching faculty know, that the calendar seems to get more and more full, and it's really hard to hold blocks of time for these experiences for students. But so far so good. And yeah, and I feel like the biggest plus for us is that we are solidly integrated into the community there's probably 12 orgs that are all just organized and working together in the space and supporting each other and sharing each other's resources. And then it's a constant, like I said, we're there being directed really by the community as they are on the leadership boards of all of these initiatives. So
Now I had did quite a bit of service learning with students at the University of Washington, and they presented a poster one year, and they did a kind of a needs assessment survey with other programs, and one of the main reasons for sustainability was a dedicated faculty member. So I would like to thank you, Laurie, for hanging in there, because that is really truly one thing that keeps a program running. Yep.
Okay, so on my part, there's not really any fiscal responsibility on our side of it, other than being able to print some paper for the final project. But our university is really committed to supporting our learning, and this course has been offered and sustained for about the past 20 years. And some of our graduates have even actually been able to create a mobile clinic as a direct consequence of our learning on this project. So we do have outcomes around this project, and mostly our challenges that we come across is that this project is a lot of work, and it's during a really, really busy semester that we all have. So because we are able to split off into 2 teams, so I had a team of 8, and so my class is 15, there's a team of 8 and team of 7. We are able to kind of divide and conquer so that all of the steps can be done to complete all of our parts. We have qualified and dedicated faculty teaching and lots of volunteers to come talk to our students as well. So we don't have any costs for people to come and provide services for us either. So it's all volunteer based.
Great, thank you so much.
Thank you, Sterling. I could tell you and a lot of our, members right now that passion work is really a lot of work, but it's worth it. Okay. Thomas, we'd love to hear from you.
Yeah, hi. My question is for Laurie. In the program that you're working with there, I was just curious, is there opportunity for the different cohorts for mentorship from maybe the older students with the cohorts that are coming up behind? Is there some crossover there? And then also, I was curious if there's, because of the setup and the goals of the project, are there opportunities for interprofessional collaboration, maybe IPE, interprofessional education, perhaps working with OT students and so on?
yes, so both. I'm excited to say. The students, we had 2. The first, I guess when we first started out, I had 3 students submit and get an Albert Schweitzer Fellowship. And the intention around that project was to establish how are you guys going to make this sustainable across cohorts? Because we don't have the bandwidth to retrain everybody, that's only coming in their second year. And so we have they've devised this officer structure, and it's volunteer, but they come out in droves for this, where we have them coming in really the first semester, mid-semester, and we have second and third years in there. And so they're all engaging at different levels depending on the level, the skill level required for the patient. We do a lot of what we call unskilled things. So we do a lot of foot baths, you know, fixing walker tips, etc. And then we also have full-fledged evals and follow-ups, and the students sort of self-sort, you know, what's appropriate, and they work in teams together with faculty supervision. At the start of every day, we do a big huddle with all the professions that come into the space. Right now, we have clinical lab science, medicine, PA, OT, and they go in teams to do the initial assessment if it's appropriate, with the intention of not requiring people to tell their story and give a history multiple times. And that works well. They kind of go in, and then they also learn that they can all take a history, that the medical student is not the one that always has to take the history. And so there are all these lovely opportunities. And I feel like one of the greatest things that's come out over the last year is for like the third year medical students to just come get the PT students and say, I don't know how to evaluate a back. And they watch them do their eval, and they do those co-evals together. So yes, I mean, they don't stay together the whole time because the priority is the patient, you know, getting the services they need, which are often much more important than what we're doing because there are food and showers, etc. So the students always have to keep that in the back of their mind, that can't do the whole buffet if that's not what they need. So yeah, so some patients will come in and see a lot of people, a lot of students, and if they have a diversity of needs and they want that many services, and then some people are just coming in for something pretty specific.
Yeah, thank you. That sounds like some great opportunities and really good learning opportunities for the other members of the team there to kind of see that collaboration and learn from. I love that that the med students can learn from the skills of the PT students and vice versa. So that's wonderful. Thank you.
Thank you. Anybody else in our audience would like to ask questions?
I'm also curious if these questions that we've already asked are raising anything for anyone in the audience. Do you feel differently about something that's proposed? Do you have a different model that you would share? Do you have feelings about required versus elective or sustainability, or who in the audience, or who in the community rather, should get your services? Justine, I see your hand.
Yeah, so I just recently relocated to Philadelphia, and I'm with Thomas Jefferson University. And here in Philadelphia, we have a pro bono clinic at Methodist Hospital, which is in South Philly. And the pro bono clinic is tailored towards individuals within the community who are underinsured or have no insurance. And it's a lot of people who have either they're asylees or they are refugees who have been relocated, or they're undocumented. And so it's through our curriculum. It's part of our integrative clinical experience for the second year students. And so the students, it's similar to what Laurie was saying, they were teamed up. And there's a clinician that comes, and we actually pay the clinicians because as like an adjunct for the 3-hour slot. And then we have our first year students come in as work study students. And so they're manning the schedule and cleaning and doing things like that. So they see their second year colleagues actually evaluating and treating and working with their clients there. So that's kind of how ours is run at this moment. It's twice a week. There is a different, so that's called Hands of Hope. And then there's a Hub of Hope, which is a collaboration with the medical students, which is similar to what Laurie was describing, where, help foot care and working with medical students and for people who are unhoused. Yeah. But I love that it's built into the PT curriculum and that it's found a way to be part of the curriculum for all of the students and that at this point in time, we have a way to help pay for it for the supervising therapists.
That's the thing that really stood out to me is the payment piece, because so many of these efforts are volunteer based, and that's great when you've got a big, robust roster of volunteers. But when that dries up, then what?
Yeah, yeah.
Or if people get different, we should reach out to this group, we should reach out to that group, and then a group gets left behind.
Right, right. And we're paying adjuncts, to come in for our MSK and our neuro series. So I see it as like no different for this. So it's budgeted in.
Thanks, Justine. Marie, I'm not trying to take over your role.
Oh no, it's a collaboration. So please, if anyone else would like to share, I'm actually trying to read through the chat. If anybody wants to share their experience in a similar field, or, maybe something different, a different perspective.
Yeah, the floor is open. We don't have to push to the top of the hour. We've had some really great conversation already, but we just want to make sure we've got space for all of that. I also want to give one more opportunity to any of our board members who have anything to announce. Do we have any deadlines coming up? I know our next town hall is on November 21st. We're trying to do them quarterly-ish. And so we will push out some information about that one and ask you to register for that one coming up as well. Of course, we have our global health reception coming up as a part of the Academy of Leadership's and Innovations Ally Fest in conjunction with Technopalooza and other elements of ALI. So we'd love to see those of you who are coming to Houston for CSM at that. We'll have more posters there, so feel free to let us know about your work in that way. I also want to invite you to join us on our social media platforms, whichever ones you're a part of. Like, I'm on Instagram, but I'm not on Facebook, and some of you might be vice versa or none. So we're just trying to find as many ways to reach people as we can. Any other board members have any other announcements to make? Yeah, Cheryl.
Kathy pinged me and said, ask if anyone wants to volunteer. So I currently, on our website right now, we have a tab for research and publications, but if anyone has looked at it recently, the folks that did that work back then did a wonderful job, but it's quite old now and outdated. So I'm looking for volunteers to help me update that tab on the website. So if anyone is very interested in doing, literature reviews or kind of keeping track of what the latest and greatest research and publications that are happening out there, I'd love to have you join our committee so we can get that updated. Thank you.
Thank you too, Cheryl, and thank you, Kathy, for keeping us all reminded of the things we're meant to say. Any final thoughts or questions or takeaways perhaps from today's conversation that anyone would like to share? All right, I want to thank Maria for moderating and our speakers, Sterling and Laurie, for being here and getting our town hall crossover with posters and a podcast off to a great start. We really appreciate your expertise and thank all of you for joining us this evening. We hope to see you at the next one. Have a great night.
Thank you, everyone.